我會唔開心，因為可能得我自己一個人。我會好驚，因為唔知醫生會做啲咩。留喺醫院好悶。我第一個感覺呢，就係好驚會打針啦。我第二個感覺就係好驚痛啦。第三個感覺，我覺得我會好掛住家庭咯。如果家庭唔喺度，想快啲好返。
仲有呢？
求上帝唔想嘔。
仲有呢？最後一個。
想爸爸攬我。
第一樣嘢就會諗，可唔可以陪佢啦？因為佢一個人嘅話一定好驚又好悶啦。第二樣嘢就係諗，就算可以陪佢，咁通常都係得一個人可以陪佢，咁就要一個人湊佢，可能係幾日甚至成個禮拜嘅時候，就會可能會好攰，好大壓力，又唔夠休息啦。第三樣嘢就會諗，好彩有買保險咯。
我諗我第一時間應該係會覺得好驚訝，點解要入醫院啦，同埋會好擔心究竟個身體係咪出現咗啲咩問題，或者有咩事無端端要去醫院啦，同埋都會好緊張啦，因為去醫院通常都係一係就探病，一係就係去睇醫生㗎啦，咁所以就會好緊張自己身體係咪出現咗啲乜嘢問題，或者因為醫院呢個環境都係比較壓迫咁樣啦，咁所以都會好緊張。
我如果入咗醫院嘅話，第一個反應應該係會有啲擔心啦，因為如果自己要入醫院，真係可能自己有啲病得有啲嚴重啦。咁但係可能都會有啲興奮，因為唔知道之後會有啲咩，可能有咩特別嘅新嘅體驗啦。最後我可能會有啲掛住屋企人啦，因為要去醫院。
我會覺得好驚，因為驚整親我自己，同埋好痛。然之後第二個呢，就係可能入完醫院後會對你個身體仲好啲呢。咁第三樣嘢呢，就係可能會有家人同埋朋友喺側邊支持同埋安慰我，咁就唔會咁驚咯。
可能冇咁都會放心啲嘅，因為有醫護人員看住，有咩病情嘅改變嘅時候啊，咁都可以有即時嘅照顧啦、照料啦。咁都會擔心嘅就係因為佢哋都可能喺醫院裏邊一個新嘅環境，佢唔熟習。如果真係要揾屋企人陪嘅時候，佢哋又揾唔到，咁或者我哋亦都唔能夠即時去回應到見到佢哋嘅時候咧，咁都驚佢哋會好手足無措啊，唔知點算咁樣樣。咁亦都會可能返到屋企嘅時候，都會有囉囉攣啦。因為平時見到佢哋屋企啊，又或者係一齊生活啊，咁佢入咗醫院嘅時候，你好硬係覺得有一啲日常嘅嘢都因為咁樣而改變咗咯。
Hello, everybody. My name is Candy Low. I am a certified child life specialist. I am also the president of Hong Kong Child Life Association. So you have just listened to our colleagues over in America talk about how child life is like over there. And with our talk, I would like to talk a little bit about the uniqueness of child life field in Hong Kong. Well, just now you also heard a little bit about different children or family members. What might be some of the concerns when they think about having to go to the hospital or being hospitalized or being sick? So I guess those are some of the elements that's probably shared across the globe, across the East and the West. However, there are something that are making our field in Hong Kong somewhat unique. So let me begin with giving you a little background and history about the field of child life and hospital play in Hong Kong. Hospital play and child life were introduced to Hong Kong back in the 90s. And since then, a lot of our colleagues work really, really hard in hospital setting, mostly in the HA hospital setting. And then by 2018, the Hong Kong Child Life Association is established. Because currently there's no local registration or licensure for the field of child life or hospital play in Hong Kong. So the establishment of Hong Kong Child Life Association is in hope to set up a benchmark for the field, trying to help the public to know what kind of training is really essential and important for child life specialists or hospital play specialists, because let's face it, it really is not just a play lady. The kind of interventions we do are actually therapeutic, and they require specific education. So the Hong Kong Child Life Association differentiate our professional members with the following requirement. Our professional members has to be registered health play specialist or certified child life specialist in accredited countries, or it has to be any person who has 1, a bachelor degree or above, 2, studied either the Hong Kong Youth Space Hospital Play Service course, or have a 3-credit equivalent of child life course taught by a certified child life specialist. And then thirdly, that person also has to have been employed as a hospital play specialist or child life specialist for at least 2 years. And all this, we really look into the application and make sure that our professional members or people we accept as professional members has the equivalent and sufficient training. Today, I am mostly comparing and contrasting 3 specific areas of our field. So the 3 different aspects or area that I'm going to look into are education, employment or professional identity, and clinical practice. Now, since I personally went through training through the ACLP, the American system, I'm going to compare and share how that education applies, or what might be some of the things that I realized when I moved back to Hong Kong, I had to adjust myself. For example, for the loss and bereavement of deaf and dying courses, because of how the culture is different, some of the Western mindset of how we look at deaf and dying actually did not necessarily apply for Hong Kong. What I really, really had to pick up when I came back was the protocol. So meaning when someone do die, what might be some of the things that needs to be done, from how do we get the death certificate to how do we organize funeral. The rundown for the funeral was also very specific based on our culture. So these are some of the things that while we really appreciate, or I really appreciate having to learn from the Western perspective or the Western framework, it really required some sort of adjustment when we apply that in Hong Kong. Another thing I would like to mention is based on the recommended courses from the ACLP guidelines, one of the recommended courses was something to help students or help candidate to really look into the DEI, meaning exploring diversity, equity, and inclusion of children and families. In America, a lot of times when we look at Chinese population or Asian population, the wordings that come would be people of color, minority, and whatnot. But then know that in Hong Kong, Asian Chinese are indeed the majority. See, if I look at the research, and the research is about Asian or Asian American, how they cope or how their development is in America, then it doesn't necessarily apply to Hong Kong because of the cultural context is so different. So maybe in a way to adjust is actually also look at how the nuance of a dominant culture versus like a subdominant culture, and how we work with people from both sides and both, side of the spectrum would be more appropriate. Another part that is very different for the field of child life in Hong Kong is about the employment part and the profession identity. So currently in Hong Kong, child life specialists or hospital play specialists are not hired by hospitals themselves. We're currently hired by NGOs and then kind of putting us in hospital as volunteers or as honorary staff, depending on the situation. Now, this unique identity actually really hinder or really influence the way we work. So, for example, when in America, when child life specialists are hired within the hospital, we are part of the staff, meaning that I have a staff pass. So no matter what department I go, as I went and support the children, I'm recognized. And other discipline would know that I am part of the staff, so I would be able to continue on, even including maybe going into OR with the children. Meanwhile, in Hong Kong, because we're not part of the hospital system, it's only the people we work with that can recognize who we are. Once we travel to another department with the children, then it's a completely different team of medical professional. And a lot of times they might see us as volunteers or even confuse us as parents. And because of that, there are a lot of times that we might not be able to do support. So that actually directly affects our professional identity in the sense that I realized in Hong Kong, I had to do a lot more of advocacy work, a lot more of educating not just parents and family, but also people we work with about our role, about who we are and what we do. And this situation is especially apparent during the pandemic. While in the West, child life specialists are being seen as an essential worker, really pulling our strength and our resource to help children and family during this crazy time that, a lot of families have never had actually, a lot of us haven't even had any idea or experience on how to really handle in such a critical time and such a time of crisis. Child life specialists in the West were able to then support family and children along the way, providing the education, providing the preparation for any procedure support, providing the normalized some activity for children to both express how they feel and to continue to connect with people who are outside of the hospital. Unfortunately, because child life in Hong Kong are not part of the hospital setting, our work actually had to be put on hold. We weren't really able to go in the hospital, be at the front line, supporting children and family at such a time of need. In America, a lot of times, other disciplines, for example, like the Dr. Clown or therapy dog, or sometimes even creative arts therapies, are actually under child life department. So the child life specialist or the child life department would actually have to allocate and coordinate all these resources to different patients. In Hong Kong, because of the way it is, a lot of these services are actually provided by different NGOs and different charities. So this part of the skill set for us to coordinate and then also support our children and family in a more holistic, all-rounded way is actually not utilized here. sometimes certain things that were very common in America. For example, I remember when I was interning, we could easily just turn the day center into like a beach because that was the beach day. But it's not as easy to do in Hong Kong since we are not part of the team. Even though I know I've shared a lot of differences and maybe even challenges of bringing Child Life to Hong Kong, I think I would also like to share when it comes to the clinical practice part. That's where we really exercise how the spirit of people from Hong Kong are like. We make work. We definitely make things work. So when it brings to like clinical practice, we had to be really creative. And due to the limitation that I mentioned, also due to the limitation of maybe resource, we had to do things that I never had to do when I was in America. For example, we had to kind of make our own doll, trying to put a pot in the doll so that we can use it to to show children how medicine is given or how blood is drawn. We try to almost be a little both a chemist and a scientist in some sense, trying to create all these props that help children to learn about like blood drawn and whatnot, right? I also started to, because I couldn't create, videos for showing children, giving them the information of different procedure support. So I started like looking online and used some existing ones from other like children's hospitals, and then just turned the sound down and VO over it. So, when it comes to the clinical practice, I think the uniqueness of Hong Kong is also the very DNA of Hong Kong, as we became very creative and became very resourceful in a Speaking of culture, Hong Kong is a relatively more collectivist culture than an individualistic culture, as it would be in the States. So even though we might not have as many single room or private room as it would be in the States, a lot of our wards are actually multi-bed wards. We have maybe up until 6 or even more beds in a ward. Depending on what specialties or what kind of ward that is. So it allows us to, apart from, if we're really working on something needing privacy with the patients and the family, we then maybe take them to an activity room or to a playroom during the off hours and whatnot. But other times, a lot of times doing things by bedside in Hong Kong would turn into like a group activity. It actually turns into not just about the patient in bed 1, because bed 2 is literally right there, right? You can stretch your arms and you're touching them already. So it turns into a group, actually. So I think that's also something that happens a lot more organic than it. I know in the West, sometimes when we talk about hierarchies, as if like, oh, there's a power dynamic, is not really, appreciated. But when we do this work in Hong Kong, their hierarchy just exists. That is part of our culture. Now, when I talk about a hierarchy, I'm talking about both adult parents and children, that hierarchy, but also medical professional and patients. So if you remember earlier in the clip when I showed you how some of the children and family members are sharing their concerns or what comes to mind when they think about being hospitalized, a few of them actually said about, oh, I actually feel more relieved because now I know I'm in the good hand of medical professionals. I now know that, they would take care of me. So, that respect to the expert, respect to the medical professional, it's something very, I would say, very unique to Hong Kong. And because of that, how in our role of child life specialists to utilize it so that it really help to be the bridge between family, the patient, the nurses, the doctor, all this different discipline. And I think that's something, that's the nuance that when it comes to clinical practice, it's something that that just by merely following the structure of the West might not be able to educate or may not be able to help our up and coming child life specialists to practice. I know I've shared a lot about the unique challenge and situation of the field here in Hong Kong. But I think looking forward, we are hopeful. The fact that this symposium exists, the fact that you're sitting there being interested in this topic, I think that's a great hope, a great light of how we can continue to build the field. Also knowing that even from medical schools now, having subjects like medical humanities, training medical professionals to start being more in tune to their own feelings, therefore they can take care of their patients by taking care of themselves. We do hope that as we move forward, we can continue to build this field together. We do foresee that there will be more challenge. But having that said, just because something is difficult, it doesn't mean we stop here. So thank you for your time.